Action. I'm Dr. David Junkin, Orthopedic Sports Medicine Specialist with Seaview Orthopaedics. Today, many of you may exercise on a regular routine in order to stay fit, and many of you are even considering beginning an exercise program. Unfortunately, injuries are part of the game, and we contend with those on a daily basis. And injuries can occur up to a third of individuals who exercise on a regular basis, many of these being overuse injuries. I will outline a few pointers here to help prevent such injury. The following is a presentation that I have developed going over the details to help prevent not only acute but also chronic injuries and to how to appropriately train. All right.
There are two categories of injuries, either the acute injury, which is the result of a single insult to the body, such as from a fall, a twisting injury, or direct blow, whereas an overuse injury is the result of multiple insults to the body, which we refer to as microtraumas. Such examples include tendinitis and bursitis. Once again, acute injuries are typically the result of a single event. Most commonly, we see fractures, tearing of tissues, such as the ligaments, tendons, or even our muscles, or even joint dislocations, whereas an overuse injury occur over time and slowly develop the result of micro stresses or traumas. These typically are manifested by minor aches or even pain. If sustaining an acute injury, it's very important to follow the right protocol. Rest, which entails immediately allowing the injured body part to recover, to see no additional stress, to apply ice to the area, which will help not only with pain relief, but will help with swelling, as will compression and elevation. Overuse soft tissue injuries typically entail bursitis, tendinitis, or shin splints. With repetitive trauma and even overuse, we can begin to have stress fractures, which are direct overuse injuries of the bone. Such injuries are very concerning, as these can lead directly to bone fracture. Overuse injuries are characterized in 4 stages. Stage 1 being pain after the activity but no functional impairment while participating in such activity. Stage 2 is pain during and after activity with only minimal impairment. Stage 3 is pain with the activity that does persist after the activity and throughout the day, and one begins to have significant functional impairment. Stage 4 results in significant functional impairment and with chronic pain. Overuse injuries are of great concern, as there's been a significant increase in such injuries, particularly in the young athlete. In fact, 50% of the injuries in which we care for are the result of overuse injuries, which can have a significant impact on a young individual who has growing or maturing tissues. Many overuse injuries are highly preventable and easily can be prevented with adequate training, both during and prior to any athletic participation. In many cases, these injuries are the result of poor preparation or preseason training. Mechanics are also a large contributing factor, as if one has poor mechanics, they are unfortunately putting increased pressure upon their tissues and joints, which can only further their risk of such injuries. Unfortunately, poor mechanics, until they are corrected, will only typically get worse with time, leading to an increase in the severity of the injury as well. When dealing with a young athlete, it is imperative to stress to them that if they are experiencing any discomfort during that activity or after activity, that they need to discuss this with either an adult or coach in order to implement appropriate strategies to treat such injury. Ignoring the pain, unfortunately, in many cases, has led to worsening condition, and we stress to the student athlete it is better to miss one practice than to miss a game or even an entire season by ignoring an overuse injury.